Maovisa ma Uiiti ma iliniki kana clinical officers nimaungamya Mukomo ula methiitwe matwaiiye kwa ilungu ya mithenya miongo kenda na vala mekia saii ya wiw'ano na nzama ya mangavana COG kusyoka wiani kwambia kwi muthenyani wa uni ona uyo uvo maovisaa ala mathukuma sivitalini ila itwa kana ciungamiwe ni serikali nene maendeea na Mukomo ngwatanio ya maovisaa ya kuko yitula muti muvea wa Uiiti nundu wa kolea kuyanesia mavatamo lina musangi na ilivoti kwa wiani.
Itina wa matuku miongo kenda makukomea wea kwa maovisaa ma Uiiti wenda clinical officers. Yu maovisaa aani meosyokethia wiani kwi uni uwakeli. Itina wa ngwatanio ya maovisaa kuungamya Mukomo na vala manengo moloto wa kusyookethia wiani.
We began our strike on 1st of April after 7 days strike notice, which was issued on 25th of March. And we have been on strike until today. We're now today, by virtue of signing this return to work, we are officially declaring that our strike has come to an end and our members shall resume duty in their respective place of work starting today and not later than 24 hours from the date herein.
We have come to an agreement and we have with us a framework that within around 60 days we'll be able to address the issues that we raised in our strike notice. Then that's a good thing. So what we have is a framework, as I have said, that provides for how we are going to sit down and negotiate, agree on each and every item in the CBA and in the demands that we presented.
So this has come at an opportunity time, and I want to say that if I look at the issues that are divided us, they were actually, there's a very thin line because they are issues that we could agree upon. We may not be able to get 100%, at least 99.9% agreement is good enough. On the issue that has been spoken by the chair, on the issue of the medical cover for staff, honestly the Council of Governors has done very well, the 47 counties. Because out of the 47, only 7 counties are in the process of ensuring that all the health workers are onboarded on some medical scheme that is actually allowable by law.
Na huyo vo maovisaa ala mathukuma masivitalini ma serikali nimekuendea na Mukomo kwa kila mwandiki munene ngwatanioni George Gibore watula muti muvea wa Uiiti kwa kulea kuyanesia imwe ya mawendekethio la maovisaa amekwenda.
I want to thank the Excellency Governors who are here with us because we have really seen commitment from the Council of Governors. But from the Ministry of Health and the people who should actually be showing leadership, we have seen lack of it. And we have not seen that commitment. So the strike continues on the side of the Ministry of Health because there are issues that we have not been able to agree. We do not have a return to work agreement there. But for the Council of Governors, I think today is the last day of our strike. And I believe that we'll be able to cordially agree on all the issues. And I really hope that going forward, we'll be able to work together so that we do not have this kind of strikes.
The clinical officers are very critical medics in our facilities because level 4 all the way down to level 2, those are basically run by clinical officers, despite the fact that we still have medical officers who are in charge, and therefore you are a very critical part of our workforce when it comes to the issues of health.
Have to do whatever it is that we're doing within the reality of living within our means. But counties are trying. Counties are trying. Even in spite of the challenges of funding, there are counties that are still recruiting healthcare workers to try and take services to the periphery and to do a lot more.
Ngwatanio ya magavana ni athuthia nzima ende na kuyandikithia kwa Social Health Insurance Fund maovisa kana Uiiti ya ukolania wa koti.
We have experienced a bit of resistance in a few places where our people out there think that The registration that is being done to onboard them is a form of taxing them, and I want to use this platform to ask our people out there to please enlist yourself with the new scheme of medical services, that is social health insurance, because the NHIF that you've been using is soon going to be a thing of the past.
Uripoti ya Mlingwa Maovo Nilina Mosangi.